Well, if you follow Haxby Shed, you know that occasionally I break away from my hobby machine shop to talk about a subject that's usually topical and technical. And today I'm going to talk about the National Health Service in the UK. Now then, I'm not going to be critical. What I do feel though is something's not right. And don't jump to any conclusions please, because I'll explain what I mean. So between 2003 and 2006 I was lucky enough to work on a massive programme for the NHS which was all about joining up their information systems. It was called the National Programme for IT and it was run by an organisation called Connecting for Health. So that was part of the Department of Health in the UK. Now if you're not familiar with the National Health Service in the UK, well let me first start by saying, you know, the UK is quite a small place, but we have 64 million people, so it's quite densely populated. And in about 1947, I think, the National Health Service was set up, and it's a publicly funded health service which we pay for out of general taxation. It has about 6,000 general practices. That means the place you go to see your doctor if you've got a problem. That's your first point of entry into the healthcare system, and it has about 1,000 hospitals. It employs about 1.5 million people, which is substantially more than the Indian Railways, by the way, and it costs about 200 billion pounds a year to run. So that's about 250 billion US dollars. I do mean billion, don't I? Yes, billion US dollars a year, and about 230 billion euros if you want it that way. So we all feel very passionately about it in the UK. We love to have it. It's run by fantastic people, all of that. Now, way back in 2003, the then Labour government, so just for people who don't live here, we tend to have two big political parties here. Labour, which tends to lean to the left, and Conservatives, which tend to lean to the right, let's say. The Labour government put up £6 billion in 2023 money to fund a massive IT transformation programme for the UK Health Service, which was intended to join up all the information. So until that point, you could go to see your GP. The GP had a PC system of some kind. Maybe they'd moved away from paper records already, but it wasn't really joined up to anything else. It was just complete standalone. And so the government of the day had the vision to invest this huge amount of money to bring all those systems together. And let me explain how that worked, what that was. So just think about the challenge of connecting all these systems together for the very first time. We're talking about 6,311 primary care settings, so I'm talking about doctors' surgeries and anything that provides care at the first level, at the point of entry. Secondary care, meaning hospitals, 1,148 across the country. Think about how many systems they have for handling patient information which were never connected together until this point. So how do you go about connecting all this together to create a joined up data set for the health service? Well, you need this block of central services. And I've written in here each of the services which were built in the period 2003 to maybe 2006, that sort of time. If all these systems are going to be connected together, you need a message network to pass the data. And that message network has to be secure. And the people who access these systems here in these hospitals and in GP surgeries need the right security clearance for your medical data. And there's got to be a whole load of security services, IT security services, which control access to all these joined up systems. And it was around the time that smart cards started coming in. So if you go and see your GP, they plug in a picture photo card, but it's a smart card. And through these services, these central services, they can access these systems. And then you've got to hold records of every person, every patient, and you've got to know where they live. And you've got to know perhaps something about their relationships, meaning, you know, if they're a child, who are their parents. That's what I mean by that. And so there was a big service set up called the Personal Demographic Service. All of these government designs always have funky names, but it was called the Personal Demographic Service. There was the Care Records Service. There was a service called Choose and Book. So the idea was to develop a system where, you know, rather than your GP always referring you to your local hospital, you'd have a choice of where you were treated. So the Choose and Book service was born. And then the electronic prescription service. So before this was launched, a doctor would write you out a paper prescription. You'd take it to a pharmacist. The pharmacist would dispense. They would then bill the NHS for that item that you'd taken. And now with this electronic prescription service, everything is done electronically behind the scenes. And we've talked about data transfer services. So all of this was called the spine. And this platform provided all of these core central services for all the systems here to talk into here across this network. Now, up until this point, the system in your local GP surgery, the system in the hospital, more than one, many, weren't designed to work across this network here. They had their own different data formats, they stored data in different ways, and all of that. So you can imagine how difficult it would be to convert all the systems in all these settings to talk this new language and support all of these new central services that are needed. And so to make that work, there were probably 6 big primary care IT providers providing patient systems, record systems in primary, and probably 3 or 4 in secondary. And those suppliers were brought together, and a huge amount of work was done in defining a data model for the NHS and process flows for the NHS, and these were then built into these proprietary systems sitting in here, and they were tested against a reference network, and lots of interoperability tests were done to make sure that everything would work together. And then software went out to these in releases, and all done collaboratively between suppliers and the NHS IT teams and all of that. So that was what I worked on for 3 years, and I worked for one of the big suppliers, not equipment suppliers, but one of the big integrators that was rolling out these systems. So that's a bit of background, and I think you can see from all of this just how complicated all that was, how expensive it was, but actually huge potential to improve care within the National Health Service by joining up all these systems. I'm sorry that I was talking to a piece of paper for quite a long time there, but I had to explain it somehow because you need that for this next bit of the discussion. So, were all those systems rolled out? Answer, no. Was the £6 billion spent? No, it wasn't, because the way in which the contracts were set up, the contractors had to adapt existing products, get them certified, and then they were allowed to approach the hospitals and the GP practices and basically say, we've got this integrated system on offer, and the funding was set up centrally by central government, and so therefore a GP surgery or a hospital could take that product at no additional cost to them for the product. But the GP surgeries tended to take them up, but the hospitals didn't. And the reason that they didn't, I think, was it was such a massive transformation for them, because you know now, it's natural now, you understand that if you buy into a system, you also buy into all the processes. But the hospitals had run with their own different processes, and these systems were so expansive that they could affect the whole running of the hospital, and particularly, a patient administration system. So when you present to a hospital, you go to a reception, they log you in, they check you in, all of that, and they track you through the hospital. That's called a patient administration system, and they can get very complex. But they assume that things happen in a certain order, and the fact of it is they don't. In a lot of NHS hospitals, they don't work to standard process. They have their own ways of doing things. Plus, you need a massive amount of training. Excuse me, I'm losing my voice. Massive amount of training. It's a major change program. And so typically hospitals, if they move to the next generation of patient administration system, they would do it over quite some years, typically. And so the hospitals didn't have the immediate need, or didn't have the resources in terms of just management time and available people to bring those systems on, even though the actual systems themselves were provided for free. So some took them on, where they'd got a patient administration system that was kind of on its knees. They took them on, but certainly not all of them. Now, one system that was rolled out at the same time was digital x-rays, and that was a massive success. And, it virtually paid for itself within a couple of years, these digital image scanning systems. And the amount of storage there used to be of x-ray film, which was hugely expensive, that was almost wiped out, within the space of about a year. Sorry, I'm beginning to drift. I'm a massive enthusiast of the National Programme for IT. You hear people say it was a failure. Well, it's not a failure technically. Did it spend the 6 billion? No, it didn't, but for some of the reasons I said there. But as a core programme, my own view is it was absolutely groundbreaking. So what? Well, the thing that's triggered this is I've had another encounter with the NHS where the systems are not joined up, and they certainly could be. There's no technical reason why they're not joined up. And so my wife got an appointment on the NHS app. So we have this wonderful thing here called the National Health Service app on our phones, and now we can see our personal data record that's held by both the GP and our local hospital, if we've had an encounter with the local hospital. And she needed a test, and so she got a notification on her NHS app that she had an appointment. But nothing else came. No letter, because typically the NHS still uses letters, and I think that's a good thing in many ways. No phone call, nothing. If she hadn't checked the app, she never would have known. So we go to the particular clinic, so because the NHS tends to be, even in the hospitals, divided into clinics. So we went to the specialist reception, let's say, and she said, yes, okay, fine, we know you come in, yes, fine, take a seat. And we said, well, there's never been any letter or anything. And the lady on reception said, oh, you should have had a letter. Oh, you not had a phone call? Oh, we not had a phone call. So she logged on to the patient administration system, and it said, oh, no, you've not had a letter. So that was big positive tick. The app worked. She knew that there'd not been a letter, but she said something like, yeah, well, the app is good for you, it's not so good for us. And I think the problem was that the central choose and book team had booked this appointment. It was on the app, we could see it. The hospital then, I think, was supposed to get a trigger to send a letter, and it didn't happen. And I'm thinking, how can that be? How can that be? Because I've always worked for very large companies, and they invest massively in IT because it saves so much money. It's not because they're nice people. They just do. And when I work for a big corporate, I'm going to go off track slightly here now, but I can get my laptop rebuilt by pressing a button. I don't go into an office anywhere. I mean, not now, I'm not doing it, but if my software crashed on my laptop, I just press a button and it rebuilt itself. And if I wanted to get onto systems, I can think of a company where there was about 80 different applications, but you just do all that with a single logon. You're not messing about with different logons. So those things, they do them because they have to be efficient. And so what am I talking about? So it just raised another flag, which is, why do we still have people? I like letters, but why have we still got people touching letters? Because every time you touch something as a human, it's costing money. And it's like, that's what's triggered this. The previous trigger was, about 5 years ago, I took my father to accident and emergency, and he had dementia. And so he had a problem. We thought it was a particular infection. Went to the booth, nurse comes, and she says, "Oh, what meds? What's his meds?" And I go, "Well, I'm not his carer. I don't know what his meds are." And she's saying, "Well, was it this? Was it that?" "I don't know." "Why don't you log on and find out?" Because I get really passionate about it, because I know all that information's on the system there. Just log on and find out. What are you asking me for? It's a bit like taking your car to the main dealer who you've been to for years, and they say, "Oh, which gearbox has it got? Has it had the upgrade? Whatever." And for all I know, he could have been taking Win-A-Lot. I could Win-A-Lot is a dog biscuit, by the way. I wouldn't know. And if you get the meds wrong, you kill people. You can kill people by mixing two meds that are not right. So I put in a complaint because I know these systems are there. And they were quite sincere and responded to my complaint. And the answer was the nurse couldn't get her smart card to work that day. So I responded, because I'd been in that background, well, why? What does the system log say? Was her password rejected? Was her smart card out of date? Was her role not allocated correctly? Because when you allocate somebody on a smart card, you've got to say what the role's going to be. You can't have one GP that sees the records of everybody across the whole country. It's not allowed. You've got to have role-based access control. So what was the problem? Look at the log. Tell me what the problem was. Let's not have this happening again to somebody else. And I got a reply, which was a bit like the first one, which was, yes, we're very concerned about this. We're going to give the nurse some training. No, that's not the answer. So, where am I going with this? Hang on. Right, collecting my thoughts. I could give you lots more examples, but we put so much effort into the National Programme for IT. I know that these systems are connected together, or certainly can be. I know I can see things on the NHS app now, on my phone, that I don't think the GP can see. And all of that. So what's the problem? What's actually wrong? Because all of this is certainly possible. Why have we got hospitals which are getting sometimes, people hacking in because the hospital's not upgraded its systems, its PCs and things from Microsoft XP? No business would do that. It's so critical. And you could say, well, it's a choice. You could fund Microsoft licenses, or you could fund doctors. Which do you want? But it's not like that. You've got to fund both, but you can't say, what's the right word? Save money to waste money. It doesn't work like that. Now, don't send me a comment that says it's all the government's fault, because it isn't. It's something cultural, I think. It's either about the British, or it's the British public services, or something. There's something culturally awry somewhere. I don't know what it is. Maybe you know what it is. I don't know what it is. But it's almost like a kind of amateurism. I'm going to get shot for saying that now, aren't I? You're all going to send me horrible comments. I'm sorry, but it is like that. It's like the medical stuff is professionalized, but the foundation upon which the whole thing runs, that's data and IT and all of that, something unprofessional about it in that sense. It clearly isn't rated important. For most companies, these days, their IT systems or their databases or cloud systems, they're absolutely mission critical, and a company that doesn't manage that properly is likely to go out of business if they get hacked, or they don't know who their customers are or anything like that. They're likely to go out of business. So pretty damn quickly. So I don't know. I hope you learnt something about all the good things that were done on the NHS IT Connecting for Health, and how positive I feel about all of those. But the frustration that all that potential has not really been fully delivered. Yeah. Well, that's kind of it, really. I don't. Is anybody still there? Is there anybody still there? Yeah. All right. Well, if you're going to send me comments, please try to analyse the problem. Don't just offload, please. It's all the governments, all the public services in the UK, honestly, and all the governments seem to have much the same problem in delivering. And don't please send me a comment saying, well, that's because they're all useless, because that's not analytical. It might be true, but it's not analysis. All right, thanks for watching.